Solix view acquisition. Position the patient by adjusting the table height so they're leaning slightly forward and gripping the handholds attached to the chin rest base. Make sure their teeth are together, their forehead is against the rest, and their eyes are level with the canthus marker. If you are right-handed, hold the joystick vertical and push the base with your left, and if you're left-handed, the opposite. Select the patient, then select the scan, both retina and disc. Start. Looking at the bottom left-hand corner of the screen, you will see there's a slider bar with a green indicator. Push forward, centering on the pupil as you go, looking for the indicator to go green and the white dots and green lines in the center of the image to come together. When they are close, look up to the IR image screen in the top left-hand corner and observe the retinal image. It should fill the window. You should be able to see retinal features and there should be no glare or overshadowing. The green indicates the tracked area. When you have a good IR image, click the Auto Adjust button. This will find the retina, correct for focus, and the polarization produced from the cornea. Once the system has stopped processing, click once in the OCT window, and then you can use the mouse wheel to raise and lower the B-scan without having to move the joystick. The joystick base should remain still, held by your left hand. Once you are happy with the B-scan position, generally with the RPE line on the bottom red line, ask the patient to blink, then click the capture button either on the joystick or using the mouse. Remind them to look at the fixation and not to follow the moving red lines. When tracking, let the patient know that they can blink as needed. If the eye starts to drift, ask the person to look at the fixation again before moving the joystick to correct it. Once the scan is finished, the X and Y cube will appear in the top windows. It will then process and produce two full-size windows that can be used to evaluate whether you keep the MCT or non-MCT version. In this case, we're going to click the MCT save. There is then the possibility to review the scan and move on to the next. In this case, it is the optic nerve. You can see the eye has shifted nasally. We move the box over top of the optic nerve, and we ensure that the focus and auto P are maximized. And we can move the scan using the scroll wheel on the mouse. The left is the horizontal window and the right is the vertical. Once you have a good image, click Start. The indicator underneath the OCT window when it hits 50% is the end of the X box, and at 100% is the end of the Y cube. You can ask the patient to blink if it looks like the eye is drying. Again, we have the X and Y cube processed, and we can select the without MCT or with MCT. We're going to select with MCT. We can then evaluate the scan before proceeding to the next. In this case, it's the left eye, so we move out, come back in. Again, aligning using the bottom left, getting the white dots, green lines, and indicator lined up. Check the IR image top left, and hit Auto Adjust. Click once, adjust the height of the B-scan as necessary. Start capture. You can see it flashing between red and green. The patient was just changing their fixation a little. The X cube is finished, starting the Y cube. Image processes, X and Y cube. Followed by the presentation of without MCT and with MCT. And again, we select with MCT, save. System saves. Proceed to the next scan, which is again the optic nerve. The eye shifts towards the nose or nasally. Adjust the scan box so that it's over top of the optic nerve. Hit auto adjust. Or if the V scan is present, you only need to hit auto F and possibly auto P. When the scan is well positioned, hit capture. And 50% is the end of the X cube. Starts the Y cube. Scan is complete, showing you the X and Y cube, followed by the non-MCT and MCT processed images. Again, we select with MCT. And if we want, we can move the B scans up and down again to evaluate the image.